Okay, welcome to our live stream. I'm Dr. Deuk Majan, and we are getting ready to perform the Deuk laser disc repair to a herniated disc at L4-5 and the Deuk plasma rhizotomy at L4-5. Our patient is actually a local patient. Shot. That looks pretty good. And he has back pain coming from the L4-5 disc. He has facet joint pain as well, coming from L4-5. So we're going to be treating the L4-5 level today with the disc repair to treat the herniated disc pain and the Deuk plasma rhizotomy to treat the facet joint pain. Jordan, nice job. Looking good. Anybody know how long he's had pain for?
40 years.
40.
40.
So
Since 1984.
that's a long time. Our patient has had back pain for 40 years. We're coming from the side, shot, and I'm going to just go past the facet joint here. You could see the facet joint. Jordan, show the audience the facet joint. Yeah, the whole thing back there. No, it's in the back. Yeah, the facet and the facet joint. Sorry. Thank you. And where's our target, Jordan? Right there. That's correct. The back of the L4-5 disc on the right side. All right. Just almost done getting into the disc. I'm literally sliding around the facet joint. Now it turns out my patient here and his wife have dachshunds for dogs, same as me. And I said to him, did you know that I have dachshunds as well? And they didn't know that. So they have 2 dachshunds and I have 4 dachshunds. All right. Man, I feel the herniation there. Let's get an AP. Everyone agree that's L4-5? Let's see that MRI. Can you lighten that up and turn the screen towards me?
No, the computer.
X-ray looks perfect. Yeah, so there's a kind of a pseudo disc down way below, right?
Yeah.
But that wouldn't be counted. Then we got the 5-1 right above that, and then we got the 4-5. Yeah, I think we're at the right level. That looks perfect. Okay, go to a lateral view. So I'm very happy with our trajectory. I'm happy with our entry point. I'm happy with our target at this point. So I'm happy with the whole navigational pathway. Okay, that's interesting. Maybe the needle got pushed back a little bit by the patient. Odd. How did that come out? All right. Looking good. How close is he to being awake? If he's a ways off, I can do his DPR.
How you doing, my friend? You okay? Are you with us? You doing okay? Can you open your eyes for me?
DPR? Let's go to DPR.
You have the...
I got it.
Shot? I thought we wanted him awake. Dr. B. You can't have it both ways. Yeah, it's perfect. That's right where we want to be. Num num.
You sure? Yeah.
Hold on. Little pressure. This is the site, right?
Yes,
Right side.
No, I mean, but that was where you put the numbing medicine.
Yes, that was
Put a little pressure. Luis, pressure. Yeah, on the, right in here, right where we saw it. Good. We're gonna go in and do his DPR, Deuk plasma rhizotomy. Shot. Pressure. Shot. So there are little veins and arteries that run right in this area where we are that we commonly encounter. And one thing we know is that inflammation definitely causes more bleeding. See where the tip is, Jordan? Show the audience the tip right there. That's literally the most perfect spot for where we need to be. Shot. Yeah. Shot. His muscles are contracting, and nothing you need to do, Dr. B, but not making it easier for me. That must be how the needle worked its way out, you know? You're doing great. Where's the scratch pad?
Late.
We don't have a scratch pad?
Late.
All right, leave it alone. Leave it alone. That's extra?
Yeah.
Huh. Shot. 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 All right, when I say shot, folks, I'm asking for a picture, x-ray picture from Jordan. I'm asking him to pull the trigger and give me a picture. Shot. That looks pretty darn good right there. Huh, Jordan? I think that's good. Shot. I just want to get back to 4 one more time. That's too low. Shot. Shot. You think he's ready? Doctor?
Check.
Pressure?
How you doing, my friend? You okay?
It should be like that.
You all right? Open your eyes. I'm going to ask you a few questions.
Think he's ready? Not yet? Real sensitive to medicine, huh? So while we're waiting for our patient to fully wake up, go ahead and play the video on how is it that a herniated disc causes so much pain. Marking pen? Okay, welcome back. You could see from the video that patients get back pain from a disc that's damaged because of a tear in the back of the disc called the annular tear. It gets the herniated disc stuck in the annular tear, and then that causes inflammation. Are you awake? He's still out. So we're going to do our discogram and we're going to move on. Shot? Yeah. You can see the giant tear right there. All right. So he's very sensitive to medicine and he's sleeping like a baby. And we're just going to let him sleep right through this. Shot? He's got nice, healthy tissues, highly vascularized. Shot. 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 Take. Shot. Tube. All right, folks, for those of you who have never seen this done, we're going to do the whole surgery through this small 7-millimeter wide tube. It's 1/4 inch. This takes the place of open surgery. By doing it this way, we don't have to open the patient up. Shot. Which means we don't cause damage to the muscles, tendons, ligaments, and everything else that is located between the skin and the spine, actually the herniated disc, which includes skin, soft tissues, fascia, muscle, and ligaments, bones, joints. All of that stuff we're leaving alone by going from the side. We're going to go in now with the endoscope and we're going to repair this disc. Do you want to show the audience how the Deuk laser disc repair works, Henry?
Not a problem.
Okay, we are now inside the... Stop holding it. You're killing me, Nikki. I want to see you succeed. It's a gentle touch, but it's appropriate touch. All right. You've seen now from our video how a disc herniation could be so painful, and you've also seen how this procedure actually works to eliminate pain from a disc by cleaning out the tear where the herniation lives. That's a piece of herniation right there. And it's just stuck to the wall from inflammation, causing scar tissue. Inflammation causes scar tissue. The more the inflammation, the more scar tissue that's formed. The less the inflammation, the less scar tissue. Inflammation is the cause of pain. It's the cause of scar tissue, it's the cause of pain. It's the cause of the yellow stuff right there, eventually calcification. We call the calcified herniation. There's different levels of calcified herniation, from lightly calcified to heavily calcified to fully calcified. There's the tear. Oh my gosh, look at that beautifulness there. Henry, you see it?
Yes, we do.
The granulation tissue. Get a picture of that.
Copy that.
Oh, man. Let's turn the light down just a little bit. I think it might be overexposed. This light, perfect. That's good. Henry, can you get a picture? Oh,
Yep, copy that.
oh, that damn thing is in the way. You see that? One little thing. I'm going to get that thing. One hit. You guys see see the pink tissue?
Yes, we do.
Right there. Henry, can you get that? Right there is perfect.
Copy that.
That is the source of all the pain. Granulation tissue within the tear, the annular tear. Henry, this is the big one. Send me a bunch of these pictures right here.
Copy that.
Is it overexposed, do you think? Should we turn down the lights, turn it up?
I
or is
think
it-
it looks fine from here.
All right, perfect. Yeah, oh, I turned off the irrigation. Remember the other day, we saw that amazing granulation tissue. They look like Polish sausages. They were huge.
We have a couple of questions.
Sure, yeah.
All three of these come from the same person of ROB on Twitter or X.
All right, very nice. Welcome to our live stream. ROV or ROD?
ROB.
ROB.
Yeah.
Is that like Rob or what?
It's just
ROB?
It says
Got it.
AKAROHBEE.
All right,
Yeah.
sorry. Don't mean to butcher your name or your handle. So, yeah, great. We have somebody from X or Twitter.
Yep.
Wonderful. Thanks for joining us on our live stream. I'm Dr. Deuk Majan. Ask away.
Their first question is this under local anesthesia?
Yeah, great question. Local anesthesia means we just inject medicine in the skin and that's it. And that's not what we're doing. We are doing local anesthesia. We did inject some medicine to make the skin numb and the muscles a little numb. But the patient is also getting sedation through his vein. So we're giving what's called propofol. In medicine in 2023, the very best drug in the world for sedating a patient is propofol. It's expensive, but it is the best. And that's what we use. So he's getting local plus MAC. So we call that MAC, meaning he's getting some sedation in his veins and we're monitoring his airway and circulatory system.
In this case, we theoretically could have done it with acupuncture.
But let's not confuse the issue. Yeah, this patient is super sensitive to the medicine and he's just sleeping like a baby. So it's not done under general endotracheal anesthesia. We don't have a tube down. We're not under any type of gas anesthetic or any other type of muscle relaxer or anything like that that we would normally do if they're doing. Yeah. It's much more beneficial to the patient doing it this way. It's safer for the patient, not putting them under general anesthesia.
Less nausea, less risk of pneumonia,
Yep.
better, clearer wake up.
Less nausea, less risk of pneumonia, less risk of aspiration pneumonia, and faster wake up and recovery. This patient's getting the very best there is. And the next question. We're almost done, Dr. B. 2 minutes.
And I parallel the anesthetic to a colonoscopy anesthetic because the propofol is the primary medication used
Yeah.
by anesthesiologists for a very common procedure that most people get.
Colonoscopy, yeah. So it's like having a colonoscopy minus the colonoscopy. The anesthetic is very similar. It's propofol sedation with a little bit of benzodiazepine called Ativan to make the patient not remember what happens in the operating room. basically shuts down the ability for the brain to make new memories for a few minutes, and that's what we want. We're just about done, Dr. B. Another minute, and we'll be done. Go ahead, next question.
Next question from ROB. I think it's Robbie. But their next question is, does the annular tear ever heal on its own post-op?
Does the annular tear ever heal on its own post-op? Well, that's kind of a double question, ROB. First of all, it wouldn't be on its own if there's surgery, right? So if you're asking, does the annular tear heal after this surgery you're watching, the Deuk laser disc repair? Yes, it does. Does it heal after other types of surgery? No, it does not. This is the only surgery in the world that allows the annular tear to heal. It's the best surgery for the annular tear. It's the only surgery. You must do a debridement of the annulus, and Deuk laser disc repair is the only surgery in the world that does that. There's no other surgery. We're the first to do it. We'll always be the annular debridement surgery. So anybody that does an annular debridement with a laser anywhere in the world will be doing a Deuk laser disc repair. That is the essence of our surgery. So the annulus will not heal on its own unless you do this, what I'm doing right now, cleaning all this junk out. Without removing this junk, you cannot heal the annulus. It's really hard to get that thing to move. Should it be held down here? Because I can't get it to twist. That's a little better. All right. That's 2 questions. We'll take the last one.
The last one from ROB asking, does the nucleus also recover and how much taken out post-op, or do they lose ROM?
Hey, great question. So first of all, the nucleus, we're not taking any nucleus out at all. We don't take any nucleus out with this surgery. Now with other types of surgery, they do take nucleus out. For example, a discectomy, they're going to take nucleus out. Microdiscectomy, they're going to take nucleus out, right? But this surgery is not a discectomy, and it's not a, it's an annular debridement. So we're actually taking the herniation out, that's all, as well as cleaning up the annular tear. I got about 30 seconds left. We should be done. Hold on. And there it is. I want to get a little bit of this right here. Very nice. But this will heal on its own, now that we've cleaned it up. You'll see in just a moment how small this tear is. Beautiful. Let's take a look at the nerve. Well, the nerve is right there in that fat. Can't actually see the nerve because it's hidden. Pretty much done here. There's the last piece of granulation tissue. You guys see it? Right there.
Yes, we do.
Just zapped it. There we go. All done. Well, that should be his back pain from this disc cured. And take a look at the annular hole right now. The inside of this tube is 5.5 millimeters. So that tear is now only about 3 millimeters wide. It will heal itself now that we've cleaned the herniation out of it. Great job, team. Folks, type up your questions. I'll come answer them for you. The next patient is marked and ready to go. Good job. We're going to need to put pressure. He's very vascular. Henry, go ahead and go to a testimonial, and I'll be there to answer questions. We're done here. here with a patient of mine who traveled all the way from South Carolina to come to the Deuk Spine Institute. She's a healthcare provider herself. She's had some back issues. She had the Deuk laser disc repair yesterday, and she wants to share some of her experience with you. Tell us about your back pain and your leg pain before your surgery yesterday.
I had surgery on L4-L5, L5-S1. So my symptoms were classic. I had the sciatic pain that ran down my leg. Every once in a while, my foot would go numb if it was pretty irritated. And then I had pain along the top side of my hip. So pretty normal type stuff. I was going to the chiropractor. I was getting massage therapy. I was starting on meds once I did imaging and made sure that this was actually a herniation and not just like a muscle pull or something. So I had kind of gone through all the things. Had back surgery in 2020 at another institute, and they did a microdiscectomy / laminectomy of L4-L5. I was good for maybe 2 years, almost 2.5. Before it re-herniated. So not the most fun in the world, because you expect whenever you go to have a procedure that it's fixed and your life will be ongoingly better. But I'm a nurse and I ride horses, so I'm pretty mobile all the time, and that kind of pain just really gets you down.
So why did you travel from South Carolina to Deuk Spine? What do we offer here that you couldn't find there?
I was on the great internet search, to find out more information. So to read more about spine surgeries, about how many times people relapse, like all what's involved. I surely didn't want to go up to a fusion because that's absolutely ridiculous. So I happened to find one of your videos on YouTube. You offered the laser therapy. I was just sold like almost as soon as I saw it, because it made sense to me.
Yeah, having the perspective of being a nurse and a healthcare provider, it makes sense. You're fixing the problem, debriding the disc tear, allowing it to heal naturally into a pain-free state. You had your surgery just yesterday.
Just yesterday.
Not even 24 hours ago. Were you in the hospital for your surgery?
I was here in your surgery site. I got here around 1 o'clock-ish. Did all my pre-op stuff. Rolled in probably around 1:35. I think our procedure lasted not quite an hour. I was out and eating dinner with my dad at 5 o'clock at a restaurant that your anesthesiologist recommended.
Oh, good.
Dr. B. He's great.
So no hospitalization.
No.
No morphine pump after surgery because you're in so much pain from
Not
the
at all.
surgery. No narcotic painkillers after surgery, right?
No.
What did you take for pain that we gave you? What new medicine did you take after surgery?
So I haven't taken any new medicine after surgery. I was on Robaxin and gabapentin prior to. Of course, I have to wean off gabapentin, so I did take my gabapentin this morning, but I didn't wake up in any pain. But unfortunately, that med you have to wean off of, so it's not like I can stop it to cold turkey.
Yeah, so basically we did a small incision. We went in with the laser and debrided your tear. And at the end, we had a tiny 7-8 millimeter incision. And there's really no pain after the surgery, so there's no need for narcotics. After your prior microdiscectomy, you probably needed to take some Percocets
that
or
was,
oxycodone.
just to roll out of bed, just to get up off the couch after that surgery.
It's painful.
It's painful.
Yeah.
It's absolutely painful.
And the difference, people ask me, what's the difference between Deuk laser disc repair and a microdiscectomy? The difference is a microdiscectomy goes straight into your spine. The surgeon has to pull all the muscles off your spine. Then they have to drill a hole in the bone to get to the disc. And they have to remove ligaments, and they have to take your facet joint partially out. There's so much destruction that goes on under the skin. The surgeons don't talk to the patients about it because
No, they didn't.
everybody does it. They think there's no better way, but there is a better way. It was developed by an Iranian orthopedic surgeon to come from the side. And I'm a student of one of his students, so second generation endoscopic surgeon, transforaminal. And it's a better surgery because it doesn't cause any damage to your spine or your body. It's wonderful.
It is wonderful, I'd have to say.
And how do you feel today? Is your preoperative pain gone?
Oh yes, all of that's gone. The only thing that I feel is like right in mid-spine where you basically stab me. And that's,
Yeah, you know about that. You watched the videos. So,
Brought a tear to my eye there for one little second.
I see.
I forgive you.
Thank you. Thank you. Well, I'm glad you're doing well. Is there anything you want to say to your fans and friends out there? Because we know you have friends. I did some shout outs.
Oh yeah, you did do some shout outs to my nurse friends, which I appreciate. And my husband has just been wonderful through all of this. He just wants me pain-free and I love him for it. So
That's
he
awesome.
Was a major contributor.
What's
even
his
though
name?
Ted, even though he's not here with me,
Hi,
he's
Ted.
here
Thanks
in
for being so
spirit.
supportive. Yeah, you're lucky you have a supportive family.
Absolutely.
It's hard for people to do this alone.
Yeah.
right?
Yeah, my dad drove me down, so he's been here with me because he can, he's retired, so he can come down. And then my husband, we have a farm, so he stayed to take care of the animals.
Well, congratulations.
Thank you so much. I
Safe
appreciate
travels.
you.
You're welcome.
Yeah.
All right. Hey, good morning. I'm Dr. R. Deuk, CEO and founder of the Deuk Spine and Deuk Joint Institute. I'm here with a patient who's traveled from Pittsburgh to Florida. And what brought you here to the Deuk Spine Institute?
Well, I have had back pain for so long, and anything and everything we did didn't help. My wife did significant research. We found you online, actually, is how it started.
Excellent. And what kind of procedures did you have done before you came to Deuk Spine?
I've had 5 lower back surgeries, 1 fuse, and the others laminectomies and so on, all within the last 3 years.
And they were recommending another fusion for you, weren't they?
They were. That's when I really began to research other options. When they mentioned another fusing, I absolutely was not going to do that. So that began a research that ended up finding you.
The Deuk Spine Institute. And what we do differently, folks, is we cure pain with one procedure. Patients don't have to keep coming back having multiple procedures and pain management. And that's kind of where you were. You were in that surgery, pain management, surgery, pain management, surgery, pain management, back and forth. And that goes on if you keep doing it for the rest of your life. But you found a way to get out of pain and you came to Deuk Spine. How do you feel today?
Unbelievable. I have not felt this good in years, several years.
And you feeling good because we put you on some new pain pill that nobody else has?
Absolutely not. I've lived on pain pills up to this point. I'm on nothing. I have a prescription for some muscle relaxers, no pain pills, and I'm on nothing.
And how did Deuk Spine Institute fix your back?
Had the L4-L5 laser surgery, and then the rhizotomy that was done a few days later. A combination of those two, I'm pain-free. I'm really pain-free.
I'd just like to point out that you, like many people, had more than one source to your back pain. You had discs that were causing the back pain, facet joints that were causing the back pain, sacroiliac joints that were causing the back pain, I think a piriformis that was causing the back pain. And because you were walking so funny, you were getting bursitis and other pain in your leg from the iliotibial band. We had to identify every one of those sources and treat everyone properly. And once that was done, it eliminates the pain permanently.
I have dreamt of feeling this way for years. Teared up a little bit this morning when I woke up. I could get out of bed without holding on to the wall, or it was just an incredible feeling.
Well, I'm very happy for you, and you could see we did your surgery with the laser, cleaning out your discs. Where did you go for your spine care? Was it a good center?
Prior to coming here,
Yeah.
I was at 2 major medical facilities in Western Pennsylvania and Eastern Ohio. Went through a lot of pain with the different procedures and surgeries I had done, and had no relief.
And what were these other facilities, you can say?
UPMC and Cleveland Clinic.
Yeah, 2 of the top spine institutions in the world, right?
Yes.
Great reputation,
Yes.
and yet they couldn't get you out of pain.
No.
And they were just ping-ponging you between surgery and pain management, surgery and pain
That's
management.
exactly what happened. Yes.
And there's no hope for actually getting cured because they don't have the cure to back pain. We do. Unfortunately, we've been trying to share that cure with them, but they're not interested. They just want to keep doing fusions because, well, let's say it, fusions make a lot more money than laser surgery does. It's hundreds of thousands, if not millions of dollars over your lifetime. That said, I'm glad you're doing well. When are you guys heading home?
Getting on a plane in a couple hours.
All right, very good. Is there anything you want to tell people out there in final remark?
I would just say that Deuk Spine Institute has been a lifesaver for me, literally. I would highly recommend it. I was being ping-ponged around for 5 years. I have dreamt of feeling like I feel right now for a very long time. So I cannot thank you, Dr. Patel, your entire staff. Everybody's been just incredible.
That's what we're here for, my friend.
Thank you, Doctor.
Give people back their lives.
Yes, thank you, sir.
All right, now go enjoy your Top Golf.
I will now. I will now.
All right, let's get you out of here. Oh, that was an enjoyable story from that patient and how we've been able to help them. So we've just completed another surgery. Our patient was sleeping beautifully through the surgery. He had propofol sedation through his vein while we gave him oxygenation, monitored his breathing and circulatory system. and he did fantastic. He's going to be recovering for an hour, then he's going to go home. Everything went very well. We didn't really have any issues. We got to see the tear in the annulus. That line up and down is the annular tear. And we actually got to see some granulation tissue, the pink stuff, the inflammatory tissue, we call it granulation tissue, stuck in the tear. That's the body responding to the tear, the herniation, with inflammation. And that's where all the little nerve fibers come from. We were able to clean it all out with the laser. It went perfect. We have some questions.
This first one comes from
Keep going.
Samir on YouTube.
Samir on YouTube. Hello, Samir. Give me 1 second. Hello. Number. Sorry, it was a, what do they call those people always asking for money? Telemarketer. Yeah. All right, sorry, go ahead.
Question from Samir on YouTube asking what's annular debridement, and before I got stem cells, will you be able to see the stem cells while performing surgery? Just a dumb question.
Samir, it's not a dumb question. It's a beautiful question. Look. Stem cells don't actually really survive once you transplant them. I know that goes against probably things you believe or heard or understood about them. We don't do a lot of stem cells at Deuk Spine because, let's be honest, they don't really work and they don't last. Not in musculoskeletal applications. So you may ask yourself, Dr. Deuk, what do you know about stem cells? Well, it turns out I know quite a bit. As a matter of fact, University of Florida, where I did my training for neurosurgery, we were a study site for an FDA trial on stem cells being placed into spinal cord injury patients. Spinal cord injury patients, stem cells placed into the spinal cord. Well, the study showed that the stem cells really didn't help at all. They didn't make any real improvement. And of course, after transplanting lots of stem cells, we realized they didn't do anything, okay? And that the only thing that was really helping the patient was the steroids. So, my friend, I would not waste your money and time on stem cells for musculoskeletal applications. Now, that said, we offer stem cells at Deuk Spine. We offer them for several reasons. Number one, people who are interested in stem cells, we want them to ask us about stem cells so we can tell them the truth. And then again, some people are just wanting stem cells as an option. And even though we tell them it's probably not going to work, they still want it done. And it's better that we do it than some other knucklehead doctor out there doing it that can hurt the patients. Because you can still cause an infection and other complications from injecting stem cells. So it's best that it's done in a place like Deuk Spine Institute. That said, you will not see stem cells. It's not like they grow. These companies make it sound like they're putting a cell in you that's going to regenerate things. It's all bullshit. Don't believe any of it. Okay? Stem cells cause inflammation to happen. They promote inflammation. The best way to think about it is imagine there's a fire burning in the forest. One strategy to deal with the forest fire is to go ahead of the fire and light a second fire and burn some trees down. Then you create what's called a controlled burn. Look it up if you don't believe me. Controlled burn, where you burn out the forest ahead of the fire in the direction the wind's blowing. That way, by the time the forest fire gets there, it has no more fuel, no more trees to burn. So it goes out, okay? It's called a controlled burn. They were very popular for many, many years. The stem cell is a controlled burn. We're putting something in your joint or tissue that's going to promote inflammation. It's going to make inflammation worse temporarily. That hopefully will burn out the inflammation. Problem is it doesn't work, okay? So we don't recommend stem cells. If you want to waste your money, if you've got a lot of money burning a hole in your pocket and you just got to spend it on something, fine, come here, give us your money and we'll do it. but just be forewarned, it will not last. So when we do the endoscopic surgery for the annular tear, we will not see your stem cells.
This next question comes from. Nerve thing in my head. Comes from MS on YouTube,
MS on YouTube, welcome to our stream.
asking, I might be the next patient. I am Mark 2. I think their name is Mark. I have a 3-level fusion in the C-spine from a car accident when I fractured C2. The big place here wants to do a 2-level fusion in lumbar. It's scary. How much post-op pain with this? I'm assuming they mean like with DLDR.
How much post-op pain with the Deuk laser? There is no post-op pain with our surgery. With fusion, you're going to be in horrible pain for months on narcotic painkillers and muscle relaxers. Your life's going to be just horrible on those painkillers, suffering and pain after a fusion. They hurt. With the Deuk laser disc repair, we have no pain from the surgery. So we don't give you narcotic painkillers or muscle. You get a muscle relaxer for one night, but that's about it. All right, very good.
The next question comes from Mohammed on YouTube, asking, what do you think of Dr. Rahim, chiropractor?
Mohammed on YouTube, thanks for writing in. What do I think about Dr. Rahim on YouTube?
Yes, chiropractor.
He's a chiropractor. Honestly, I don't know Dr. Rahim. I don't have any opinion on Dr. Rahim. As far as chiropractors go, the good ones I like. They're very helpful for patients. There's nothing wrong with doing chiropractic. It's the crazy ones that put a towel around your neck or a rope around your neck and suddenly yank your neck. Those are the ones I'd say avoid them. You know, chiropractors, there's nothing wrong. They're doctors. They understand the spine. They try to help patients. My opinion of chiropractors, as long as the chiropractor is doing good chiropractic medicine and not doing crazy things like the Y-strap, then there probably could offer you some help if you're having back and neck pain. Of course, it's temporary help. It will never fix your actual problem, in my opinion. Dr. Rahim would probably disagree with me, and that's fine. But that's because I actually understand how to cure pain. Dr. Rahim does not. Most chiropractors do not, and they're not capable of it, by the way. So pain comes from discs, facets, sacroiliac joints, piriformis muscle, and coccyx. Each of those diagnoses cannot be fixed with chiropractic, period. Patients can feel better for a little while after manipulation, but they will not be cured of their pain. We have curative treatments because we know exactly where the pain comes from and we know how to cure it. And it always requires, I hate to say this, it sounds terrible, but it truly requires a surgical procedure, even though it's this minor procedure like you just watched. I was just like everybody else at one point. I believed that, oh, back pain, first try therapy, try chiro, try time, it'll get better. But the truth is, it does get better in a lot of people when it's the first time you've ever had pain. But if you have chronic pain, pain lasting more than 6 weeks or 3 months, that pain's not going to go away on its own. It may get better temporarily for a little while as you take it easy, but once you get active again and start moving around using the joint, you're going to have pain again. That's just the reality. So the truth is, those kinds of pain need a surgical treatment to fix them. The question is, which treatment will fix them? And the answer is Deuk laser disc repair for disc problems, Deuk plasma rhizotomy for facet and SI problems, and Deuk piriformis release for piriformis syndrome.
The next question comes from BBC Off-Road on YouTube.
EVC off-road?
BBC.
BBC off-road. Okay, very good.
He says, or they said, we need you out west. Any thoughts of cloning yourself and opening up in Arizona? I want to fly out to you to fix my neck soon.
I love people with a sense of humor. Shows great intelligence. Listen, I would, I don't know. I mean, on one surface, I'd love to clone myself, but I think there are better versions of me coming. My son is at Princeton in his first year. Arias, who's friends with Henry here, and Arias has really made my year by deciding to go into medicine. He was wanting to do investment banking, private equity. He's a brilliant kid. He could do anything he wants. Far smarter than me. And he's very compassionate, very sweet kid. And now he wants to go and become a neurosurgeon like Dad and treat patients at Deuk Spine. And that is the greatest gift I could possibly ever get in my life, is knowing that my son, and hopefully my daughter too, will follow in my footsteps and carry on my work. Because that means they truly believe in what we do. And he's a humanitarian person. He wants to help other people. I know we get a lot of complaints about the cost of our treatments. Trust me, I don't want to take a single dollar from a single person. The only person that should be paying for these treatments is the insurance companies. But, you know, fighting the insurance companies to get them to pay consistently for anything in healthcare it's become like, I don't know, trying to get Palestine to kick Hamas out and be reasonable and live in peace with Israel. It's just almost impossible. It'd take a miracle for that to happen. So until that day, we have to fight them, and fight them we will. Just like the Israelis are fighting, just like the Palestinians are fighting. You have to fight for what you believe is right, and we will fight the insurance companies. But I swear, there is not a single person that I ever want to take a dollar from but the insurance companies. They're the ones who are supposed to be paying. That said, we have good news for those doubters out there. We received an insurance company payment today from United Healthcare for a Deuk laser disc repair. I'm going to get that EOB, I'm going to print it out, and I'm going to show it to you. And I'm going to show you a few more over the next few weeks when we come back in January. The insurance companies do pay for these surgeries. However, they don't pay every time, and they pay infrequently, so we never know when they're going to pay. And we can't rely on them right now to pay consistently. So, because of that, we do have to ask people for money up front, and people pay because they're smart. They know they want the best surgery, the best treatment for their back. You only get one back, folks, one neck. And God forbid you go out there and you get bad surgery done, then you're going to get into that vicious cycle of more bad surgery and more bad treatment. Your whole life gets consumed by pain. And nobody should live in chronic pain. No one. We now have a cure to back pain. We have a cure to neck pain. The problem is getting the word out.
This next question comes from Stephen on YouTube. These next few questions come from Stephen on YouTube. Asking, my dad is 80 and a former Navy vet up here in Canada. He had spinal fusion from his Navy days, but still has major back pain. If it's herniation or stenosis, are you still able to operate on that?
Yeah. Is that the first question?
That's the first question.
All right. So, Canadian,
80 years old, former Navy vet.
yeah, but what's the name of the person
Oh,
asking?
Stephen.
Stephen from Canada, your father, 80 years old, veteran. If your dad has pain, we can cure it. That's it, period. And don't try to overthink it, folks. You guys are not neurosurgeons, you're not us. It's great that you want to understand the basis of your problem. I get it, and I will teach it to you. But your father, and I don't have his MRIs, I don't know what's going on, but his pain is not coming from stenosis. Spinal stenosis never, ever, ever, and I mean ever, has caused back pain. Ever. Now, people with back pain have spinal stenosis. There's no doubt about it. People with back pain have spinal stenosis, but spinal stenosis doesn't cause back pain. Therefore, fixing your spinal stenosis will not fix your back pain. We need to know the source of the pain. I can figure that out. If you fill out an MRI review form, go to our website, mri.deukspine.com. Free MRI review. We don't charge. Basically, you upload his MRI or send us the CD by mail, FedEx or UPS. The address is there. Fill out the form, send us the MRI. In 10 minutes on a Zoom call between me and your father, I will tell you exactly why he has pain and how we can fix it. It's probably going to be, if I had to guess right now, I would guess that it's his facet joints or his sacroiliac joints. Very common for people to have SI joint pain or facet pain after a fusion. Okay, but I can tell you literally in honestly 30 seconds, I can tell you by looking at his back where he has pain, but I need to do it on Zoom. That said, plan on bringing him here next year and we'll fix his pain.
Next question from Stephen asking, also, what do you think of what they call spinal decompression to fix or relieve from herniation? And also, I want to thank you for this channel and the truth you are telling. It's really a blessing from God.
Thank you, Stephen. That's why we're here, because there's so many lost souls out there searching for answers, searching for the truth. Hey, I know I can't fix you all. I get it. And probably 1 out of 10 at most will come here. But that's not my goal. My goal is to impart knowledge and truth and understanding for the people that are suffering, because you're not going to get it from your doctors. You're not going to get it on the internet. The problem is nobody really understands why people have back pain and neck pain, but we do. We cracked the code. We know it. We've known it for years. We've been trying to get the message out. This channel is how we get the message out. This channel is how we educate people. This channel is how we inform people. We have no other way to do it, okay? That said, I am making a movie. Hopefully Netflix will pick it up. We'll see. And actually, it'll be a series. If Netflix picks it up, then we will have a series. And in that series, I will teach you so much that the world doesn't understand about joint problems, back, neck, the spine industry, the insurance companies, and how corrupt they are. We're going to go to town. We're going to expose it all. We're going to dig it all up for the world to see the truth, because I think people need to know the truth. The truth has been hidden from you for too long. The world, these big companies, this industry is so corrupt, and they're just preying on people who are suffering, and it makes me sick to see it happening, you know. And I think it's just gotten a lot worse in the last 20 years. I've just seen it get worse. It's really bad. It's really bad, and it has to stop. And I'm going to be the one to make it, at least give you guys the opportunity to stop it by exposing it. So yeah, you're welcome for the channel, and you're welcome for all the knowledge that we impart. And question 2.
That was it.
Did I answer it?
Yeah, that was the question. Question. This next one is from I'm not really. B.S. Van Wilden.
B.S. Van Welden.
Yeah, B.S. Van Welden. They said, I've had 17 neck and spine surgeries. My neck has been to hell and back. I currently have solid bone fusion in 1997 failed fusions, but now I have the fusion in the center and ADR above and below fusion, and I had 2 spinal cord stimulators and had them removed for still dealing with low back issues, but holding out for better ADR for lumbar. No fusion, spine made to move.
B.S. Van Welden, stop. I can't take it anymore. First of all, I am so sorry. 17 surgeries on your spine and still, right? Still suffering. You would never have 17 surgeries on your spine if you came to Deuk Spine. You are exactly what we are trying to stop from happening. Every one of those 17 surgeries, go get a calculator, add up all the money that was charged. I guarantee you it's over $1 million. These hospitals, surgeons, doctors, and implant companies, insurance companies, maybe not the insurance companies in your case, but my God, they are just, the way I think about it, you're like a piece of meat out in Africa, an animal that gets taken down by a pack of hyenas, and they're just eating you while you're still alive. That's really the image I'm thinking of when I think of 17 spine surgeries, and here you are still suffering. No human being should have 17 surgeries. You should have 1. Rarely do our patients need 2. Rarely. Like literally less than 3%, right?
I think so. Yeah.
1 surgery and your pain should be gone. I'm so sorry you're going through this. Do not let them put an ADR in your back. Come to Deuk Spine. We will fix you with our laser and plasma technology. I guarantee it. Do an MRI review. It's free. Go to the MRIreview.com form at Deuk Spine Institute. Go to our website, type up the form, fill it out. It's free. We don't charge you a dime. You get my honest opinion from your MRI of your back, I guess, because that's what's bothering you now. And I will tell you exactly where your pain's coming from and what needs to be done to fix it. And it will not involve artificial discs or fusions. I guarantee you that. Oh, breaks my heart to hear your story.
This next question comes from Samir, once more on YouTube, asking, thanks for the info on the stem cells, but will you be able to fix the inflammation it created? Please fix me up, Doc.
Yeah, Samir, we can fix you. I just need to see your MRI. Get me your MRI, do a Zoom call. All this is done through our MRI review process. I don't charge. It's free, literally free. There's no advertising, there's no commercials. You don't have to sign up for our email. We don't blast you with garbage. We literally just want to tell you what's wrong and tell you how to fix it. The rest is up to you.
And then, last but not least, from Betty on YouTube, asking, what is the difference between RT and DPR procedure?
Oh, RT.
I think it means like design.
Radio frequency.
Okay.
Well, I'm not sure what RT, but I think you mean RFA, maybe radio frequency ablation. That's typically what's done for facet treatments. Here's the difference. This is what a RFA does. You see that little red dot right there?
Yep.
This is what the Deuk plasma rhizotomy does. It actually knocks out the pain nerves. Radiofrequency ablation doesn't kill the pain nerve. All it does is stun it, and then it's back again within a few weeks or a few months. And by the way, the more arthritis you get over time, more scar tissue covers those nerves. It's impossible for RFA to work. It doesn't work. So I pioneered a new technology where we actually go in and burn the hell out of that whole area with a special probe that delivers about 10 times more energy than RFA. We are patenting it. It's in the US Patent Office right now, and they're considering it for patent. So hopefully we'll get our patent, and either way, it doesn't matter. We still will fix patients like you. So if you have facet pain and you like going to the doctor 3 or 4 times a year for the RFA treatments and the MBBs that go before it, then the Deuk plasma rhizotomy is not for you. The Deuk plasma rhizotomy is a permanent fix. So if you just want to go to the doctor one time, get it done, and never come back for that problem again, that's what the Deuk plasma rhizotomy does. But if you like going to the doctor and you like spending your time and money and getting procedures done, then don't do the Deuk plasma rhizotomy, because we're going to fix your pain.
And that's it.
All right, that's the last question. We do have one more surgery coming up. It is a bilateral L4-5 Deuk laser disc repair. Now, this patient's primary problem, he does have back pain, but he's got pinched nerves so bad he can't even walk. You should see him walk. It's horrible. He's bent forward, he can't straighten up, he's been that way for a while, and basically we're going to go in there and unpinch the nerves.